Hi heroes, I'm Rachel Hernandez. I'm the communications manager here at VetComm. We're so excited to announce that thanks to our new partnership with Veterans InfoTap here on YouTube, we'll now be able to connect you with his latest videos and bring you even more great content. Here at VetComm, we've been keeping you up to date with all of these federal funding and staffing cuts that are affecting the VA and veterans. The latest one, and the largest, is that more than 80,000 employees could be cut from the VA in August. How are all of these DOGE efforts affecting veterans? Veterans InfoTap has 5 points for you.
Thanks for making it to Veterans InfoTap. I'm glad you made it. There are 5 reasons veterans are especially hit hard by federal cuts, according to this headline. I wanted to read through it here with you, see what your thoughts are, see if this is on target. 5 reasons veterans are especially hit hard by federal cuts. Now, before we jump into it, I want to throw on a special thank you to R. Stiltskin. R. Stiltskin, thank you so much for the super comment, super chat. I really appreciate it so very much. I appreciate the support. Thank you, R. Stiltskin, for that. And let's jump into it. So the headline, this was on Yahoo News. And again, the headline, 5 reasons veterans are especially hit hard by federal cuts. Let's see what they have to say and see if it's true. All right. The Department of Veterans Affairs is planning to cut 83,000 jobs, slashing employment by over 17% of the federal agency that provides health care for millions of veterans, according to an internal memo obtained by the Associated Press on March 5th, 2025. By the way, I also received that same document and I shared it, I don't remember when, recently. You can definitely take a look at that and go back. I read it verbatim. And the one thing I'm going to throw out here, which is very interesting, is, and I did this in another video, if you go back a little bit, remember that there was a $6.6 billion, let's call it $7 billion shortfall on the VA healthcare side. That was last year. This number was revised by the prior VA secretary somewhere around November. They revised it downward and said, hey, look, we're still short nearly $7 billion on VHA healthcare. Remember that the VA hired more than 60,000 employees I believe it was in 2024. And now we're reversing this with this 83,000. But the funny part, and it's not really funny, but the interesting part here is that if you take $7 billion and which is the shortfall, right? If you take the shortfall, $7 billion, and you divide it by 80,000 employees, it's $87,500 per employee. Now, even if you think that that's high per employee of these 80,000, remember that really the salary equates to a portion of that. The salary might be $65,000 average, but when you add in all of the benefits and overtime, not overtime, paid time off, benefits, healthcare, that type of stuff, it actually bumps up that cost, the employee cost, really kind of substantially. So 87,500 could be a really realistic number. So it's just interesting that 80,000 employees really kind of equates to the same dollar amount that the shortfall was last year. So as we move on. All right, the department known as the VA manages and directly provides comprehensive services for veterans. Those services include healthcare, short and long-term housing options, life insurance, pensions, education stipends, and assistance in jails and courts. For those that don't know, there is I think it's Veterans Justice Outreach coordinators, something like that, that help with veterans who are entangled in legal aspects. Not really civil, but more criminal. The VA also engages in path-breaking public health research. 1/4 of the VA's 482,000 employees are veterans. So 25% of the VA's workforce are veterans. For the past month, the Trump administration has been cutting federal spending, causing numerous hardships for government employees, the agencies they work for, and the people they serve. But veterans are among those hardest hit. and the impact goes well beyond job loss. My research, whoever this is, not me, on veterans in the criminal legal system illustrates the stark challenges that service members already face as they integrate back into civilian life. Trump's budget cuts will make this process only harder. Here are 5 reasons why. Eroding the federal workforce. Federal law requires employers to give veterans an advantage in hiring over people who have not served in the military. Under the 1944 Veterans Preference Act, employers should hire veterans over other candidates and retain veterans over other employees during layoffs. The idea is to compensate for the economic loss of serving in the military and acknowledge the government's obligation, especially to support disabled veterans. Due to this veterans preference, nearly 30% of federal workers are veterans, half of whom are disabled. This means that veterans who make up 6.1% of the U.S. population are disproportionately affected by federal worker cuts. One estimate is that of the 38,000 federal employees fired at the first 5 weeks of the new administration, 6,000 of them are veterans. Gutting VA healthcare. Cuts to the federal workforce are also affecting medical care for veterans. The Veterans Health Administration workforce constitutes 90% of the 482,000 workers. So cuts to the VA workers means cuts to VA healthcare. Again, this is why it's interesting to me that the healthcare side is short on their budget. It was $12 billion according to the prior VA secretary in July. We're short $12 billion, he says. Then they revised the number to we're short $6.6 billion. Let's just round it up to $7 billion. So that $7 billion shortfall is on the healthcare side. We also, using these numbers, 90% of the 482,000 workers are on the healthcare side. That means that the majority of the 60,000 employees that were recently hired are also for the healthcare side. So it looks to me, and it's just me looking here from the outside, I have no real clue here, but it seems to me like there is a direct connection between the removal of employees to compensate for the budget shortfall. If there wasn't a budget shortfall, sure, maybe we'd be still looking at 20,000 employee reduction. It's hard to say, but it's just interesting the way that these numbers are kind of coming in for me anyway. I'd love to get your thoughts on it. Let's move on. It says here, these cuts come at a time when veterans' healthcare needs are increasing. The VA enrolled 400,000 veterans in its benefit system from March 2023 through March 2024, 30% more than the prior year. It also expanded eligibility for former service members to receive VA health care. That is true. So through the PACT Act and all of that, there was the opening to VA health care. They basically knocked the door down and removed requirements for 1 million plus veterans to be able to access the healthcare system, which is great. But in order to accommodate that, you need to kind of be ready. So it's a big number. And the way that it used to be was there were 5 or 6, categories in which you could qualify for healthcare. The most common doorway into VA healthcare was service connection. You have a service-connected condition, you can now go to the VA for healthcare. There's other things that you could use to get into the VA healthcare system, like means testing. If you are low or no income and you prove that to the VA, you could go get healthcare. All of the different aspects to be eligible for VA healthcare are on the form 10-10, the 1010. So that is the application for healthcare, and it spells it out. So if you're curious. All right, so let's move on. It says here that the increase in enrolled veterans into the healthcare system was 30% more than the prior year. It also expanded eligibility for former service members to receive VA healthcare. Trump's cuts will make it more difficult for the VA to provide healthcare for these newly eligible veterans. These cuts roll back President. So before I get there, here's the other thing that we don't know, right? Is if you do an overlay on the United States, how many veterans who are enrolled in VA healthcare are within a certain parameter, right? Within a 30-minute drive to a VA medical facility. And how many are not? 30-minute drive would be if it's over a 30-minute drive for general appointments, would be a qualifier to receive community care. So is part of this juggling that around? There's so much to really understand and look at. Will it impact? Sure. I mean, look, 80,000 is a huge number to reduce your workforce. And according to whoever this person is, they're saying 90% of those folks are VHA. There's going to be an impact. What impact is that? I don't know. Is the impact instead of getting an appointment at the VA, your appointment's now at a community care provider? Is that the impact? I don't know. So let's see what else this person has to say. All right. So it goes on to say that the cuts roll back President Biden's investment in the VA to address longstanding staffing problems. The Office of Inspector General's 2024 report on the VA staffing shortages revealed that 137 of the 139 VA health centers nationwide report a severe staffing shortage in at least one area, particularly nursing and psychology. Staff shortages have led to long wait times for care. These wait times vary from days to months, with some VA clinics still so understaffed that they are unable to take new patients for primary care or mental health needs. All right, so I'm going to add in here that the staffing problem has been around for a while, especially geographically, right? Some areas more than others, but in some areas, the VA just simply didn't pay enough for a doctor to go work in an area and get paid, $150,000 less than if he went down the street and got a job. Some areas cost a lot to live. The cost of living is high, and so it makes it expensive to live there. You want to live near where you work, ideally, and these positions were sitting empty. And doctors, there was a retention problem or an attrition problem, either way. So in any case, there's also that aspect. I think that in some cases, some positions may be underpaid, and that could be part of the problem. All right, so staff increases over the past few years shortened wait times while providing care to more veterans. In 2024, the VA said it was working hard to fill its 66,000 positions. In 2024, last year, the VA said it was working hard to fill its 66,000 vacancies. I'm also going to throw out here, and I'm going to pause this and I'm going to come right back if you're sticking with me. All right, I'm back. So here's an interesting piece and it seems to me like people just forget things, right? So one, the budget thing that I talked about earlier, but here's another interesting fact. March 14th, 2024. Okay, March 14th, 2024. As the recording of this, less than 1 year ago, barely, but basically a year ago. And in 2024, the year of 2024, here's the headline. VA looks to cut 10,000 positions from healthcare workforce. But let's forget that the VA was ever going to do that and just focus on the today and now, right? So it's interesting how much the pendulum swings back and forth with the VA. I mean, look, And I'll throw this out there too, but it's still, I mean, how can you change so much in a 1 year time frame? And I'm just going to stay within the prior VA. Obviously, we know what's happening now, but there was a 10,000 cut on the board of positions in the healthcare workforce in 2024, and announced in March of 2024. Then I can't remember when, but at some point the VA reversed course, and that was probably 6 months after this. They ended up saying, so about 6 months ago, the VA in the prior administration said, you know what, hey, actually, I think we're going to try to hire 5,000. So of the 66,000 that they hired, they actually wanted to cut 10,000 from the healthcare. And if I remember right, their plan was to let that happen by attrition. So just throwing that out there to you as well. All right, so then there's another article that comes out November 19th, 2024. And in there, what we have, I'm just going to give you this little snippet. Now remember, in March, it was let's cut 10,000 healthcare workers. Okay, March of 2024, cutting 10,000 healthcare workers. Now, 4 months ago, November of 2024, the Veterans Healthcare Administration hired more than 61,000 employees in fiscal year 2023. It's the fastest rate of growth in 15 years, but pursued a net zero growth model in 2024 in anticipation of budget constraints. So some issues with budget. Despite that belt tightening, the VA is looking to add 5,000 positions to its healthcare workforce by the end of the year. So again, cutting 10,000. Oh, now let's keep those 10,000 and let's add 5. That's a 15,000 employee swing in a matter of 6 months. So, there was a lot of that going on, the back and forths, nothing really definitive. But I just wanted to mention that because who knows where we really are is the funny thing, right? It's nobody likes to lose anything. I get it. Nobody wants to have anything cut. I don't want anything cut. Keep it the way it is. Focus on everybody else. That's good for us. I'll take it. But here we are. So let's move on in this. So it says here that in 2024, again, the VA said it was working hard to fill its 66,000 vacancies, aiming to improve healthcare for the more than 9 million veterans it serves. Now, just over 1 year later, the VA faces the loss of 83,000 jobs. These cuts may contribute to fundamental changes in VA healthcare. Rather than help veterans directly, the VA may pay for veterans to seek medical care outside the VA system, leading to higher costs and lower quality. That's arguable, I think. I don't know if it's really higher costs. You don't have any pensions you're paying. You don't have any retirements paying. You're not paying for health care. You're not paying for time off. You're not paying for workers' comp. You're not paying for any other sort of situation that could pop up on the legal or HR side. And lower quality, I mean, it just depends. There's some great hospitals and care providers out there that don't work at the VA. To say that is I don't know. I don't really agree. All right, so moving on. Other Trump directives will prevent gender-affirming care to veterans. Veterans with diagnosis related to gender identity increased from 2,513 to 10,457 between 2011 and 2021. Number 3, destaffing the suicide hotline. Well, I just did a video on that, and apparently they're hiring dozens of VCL workers, Veterans Crisis Line workers, and they have also just exempted them from return to the office, meaning that they can continue to work at home. But anyway, let's read what they have to say. In Trump's cuts to we'll try it again. In Trump's cuts to social services, the country's Veterans Crisis Line, which both the VA and the Department of Health and Human Services oversee, is losing employees to layoffs despite existing staffing shortages. An estimated 800 to 900 of the 1,130 Crisis Line workers have always worked remotely. So ending remote work options will further undermine staffing. Okay, so that's already been corrected. Current data shows an average of 17.6 veteran suicides per day. Suicides remain the second leading cause of death among veterans under 45 years old. Current VCL caller data is not publicly available, but staff report that the service fields 60,000 calls a month. In the past, VA reported nearly 3 million calls between 2009 and 2017, which led to 82,000 emergency dispatches to prevent veterans from harming themselves. The VA steadily increased crisis line staffing to address concerns that, given the volume of calls, veterans were not receiving help in a timely manner. All right, so moving on. Losing reach is number 4, they say. The VA's investment in research, about $916 million a year, has contributed to a comprehensive understanding of veterans' well-being, meaning that the government can target aid toward those in need. VA research has also helped spark major medical breakthroughs on the link between smoking and cancer, prompting the Surgeon General to put warnings on cigarettes and the most widely used method to measure and treat prostate cancer. VA research and data are instrumental in the social sciences. There are millions of veterans who come from diverse social demographic groups, and social science researchers are able to track them over time. Everybody loves to be tracked, don't we? All right. With overall budget cuts at the VA and the federal workforce reduction, at least 350 VA researchers will likely lose their jobs. That, along with Trump directive to stop research on how poverty and race shape veteran health outcomes, will undermine not only the general well-being of veterans, but also the entire medical establishment's knowledge about substance use, mental health, and deeper insights to VA research that VA research can provide on prevention and treatment of cancer and cardiovascular disease. Number 5, they have here looming cuts to other benefits. So some of these things, just to throw out there, may impact, possibly, could be's. So I mean, I don't know. Anyway, love to get your thoughts in the comments, please. If you're still here, 22 minutes in, I'm going to jump to number 5 here, and then we'll wrap it up and go from there. Looming cuts to other benefits. Numerous reports indicate that Republicans in Congress want to reduce so-called entitlements, including food stamps and Medicaid, the health insurance for the country's poor citizens. Cutting Medicaid would hurt veterans health too, because not all veterans have access to federally funded health care through the VA for a variety of reasons. Estimates show that over the past decade, nearly 10% of veterans use Medicaid for at least some of their health care, and 40% of those veterans rely exclusively on Medicaid for their health care. Further, approximately 400,000 veterans are uninsured. Given their income, half of these uninsured veterans should be eligible for Medicaid as long as looming cuts don't change eligibility requirements. In addition, 1.2 million veterans receive aid through the federally funded Supplemental Nutrition Access Program, or SNAP. Working age veterans face an elevated risk of experiencing food insecurity compared to their non-veteran peers. Veterans are still overrepresented among the homeless population. Many do not have financial flexibility to make up for these cuts. Making good on a promise, all Americans are affected by federal funding cuts, but as my research shows, the budget slashing looks to be especially hard on those who have served in the military. So it kind of continues on here. I'll just do these last two little paragraphs since we're here. The media and political blowback against Trump's cuts have already begun. Negatively impacted veterans are gaining increasing visibility. Both Democratic and Republican lawmakers have begun calling on the Department of Defense to prioritize retaining and rehiring veterans. The first Trump administration committed to expanding services for veterans. Now it's executing a stark policy reversal with acute consequences for the very same veterans the U.S. government promised to protect and serve since the country's founding. So it says here, this article is republished from The Conversation, a nonprofit independent news organization bringing bringing you facts and trustworthy analysis to help you make sense of our complex world. It was written by Jamie Rowan, UMass Amherst. All right, so there you go. This was on Yahoo News, and then they stripped it from that place. And I just wanted to get your thoughts. At least it sparks some thoughts. And really, look, if you hung on to the end, I'm not taking a position anywhere. I'm just trying to give you information, and then I'd love to see the comments so we can kind of make some sort of a rational decision, or not decision, but just have some sort of rational understanding of what is happening and what is impacted, and draw some lines around some things if we wanted to. All right, with that, thanks for watching. I appreciate you. Have a great one, and remember, if we don't take care of each other, something went wrong.